You're watching the Wellness Hour Live. I'm Randy Alvarez. Today's topic, ozone therapy. It's being used for a variety of ailments. My first guest is using it for people with chronic fatigue, with different autoimmune problems, even cancer. With us, we have Dr. Howard Liebowitz. Dr. Liebowitz, welcome to the program.
Thank you, Randy.
So what is this ozone therapy?
Well, it's called hyperbaric ozone therapy, and it's actually developed many years ago. Probably goes back to the 1950s. And what ozone is three molecules of oxygen bound together. So it's an unstable gas. It's a gas. And it gives off one of the oxygen molecules very readily. And the oxygen actually has a lot of benefits in the body. Okay. So what this hyperbaric ozone is the gas is generated from oxygen. We start an intravenous line in a patient and actually remove blood into a vacuum bottle, 200 cc's of blood, and then pump the ozone gas into the bottle and mix it with the blood and then give the blood back to the patient. And this is done commonly in Europe. It's actually started in Germany. It's FDA approved in Germany. It's in Italy, it's in France, it's in Switzerland. Many, many European countries do this. It's traditionally standard in many doctors' offices in Europe.
How are you using it and what are the results?
Well, I've had patients who will come to me because traditional doctors have no options for them. I'll give you an example. I have a patient, it was a fabulous case I had. A young man, probably 28 years old, muscular, bodybuilder type, great shape, working out. All of a sudden he gets sick. Doesn't know what's wrong with him, but he just has the blues, the blahs, no energy, a little bit of fevers and chills on and off. So he went to an infectious disease doctor and the doctor diagnosed him with hepatitis C. Just like that, hepatitis C. It was a false positive. And it turned out to be, he was devastated, as you can imagine. Never had an exposure, never used needles, didn't have any exposures, anything like that. Goes through a whole workup and everything, finally realizes that that's not the correct diagnosis, but he still felt pretty sick. So he came to see me. I started giving him intravenous high-dose vitamin C in combination with the hyperbaric ozone therapy. And in about 6 months, I was treating him once or twice a week for 6 months. He slowly started getting better. And he's now completely back to normal.
So what are other applications? Because we mentioned cancer at the top of the show.
Well, one of the things that the ozone is really great for is it kills viruses. It's been shown to kill viruses, it kills bacteria, it kills yeast, and it helps to boost the immune system. It upregulates the white blood cells in the immune system. So not only does it help lower these infectious agents, it also helps your body fight the infectious agents. And that's what I think happened with this young man. I think he had picked up some kind of virus that was non-detectable. There's a lot of viruses out there. And we just worked with his immune system and helped build up his immune system. And basically his body fought the virus off.
So in the literature, ozone does kill some bacteria? Yes, I know in dentistry, by the way, there's dentists that are shooting it into the gums to, in fact, just the gas against the gums, and they say it kills the bad bugs.
Before penicillin was invented, in World War I, this is how they treated injuries from the battlefield. Is they would take people's legs and they would saturate them with ozone-saturated saline and oils, and it killed the bacteria. It actually is good for treating gangrene.
Now, you know, on this show, The Wellness Hour, and we call it The Wellness Hour Live, I'm trying to keep mainstream doctors on here, okay? And this does sound way out there, okay? You're saying it works. People need to know, you know, I guess 20 years, trauma center at Cedars-Sinai. Is that correct? Yep. Tell us a little bit about your background training and how you got involved in doing what you're doing.
Well, I was doing ER for a long time, as you know, level 1 trauma center, and I was board certified 3 times in emergency medicine. And my ex-wife at the time was a gynecologist, and she started going to functional medicine conferences. And I started tagging along with her. We'd take a little vacation for a weekend, go to a conference. That's where I met you, I think, actually. Yeah. And a light bulb went off in my head, and I was like, wow, my patients don't seem to get better the way these functional medicine patients get better. And it just became obvious to me that something I was doing, all that hard work in the emergency room, we were patching people up, we were putting them back out there, but they kept coming back, and no one seemed to get better. And the functional medicine people, and there were a lot of patients we used to see that we had no answers for. We used to send them to psychiatry. You probably remember this. These are patients, oh, it must be in your head. There's nothing wrong with you. They actually had problems. And now we know maybe they're food allergies, maybe they're toxic exposures, maybe it's heavy metals. We never even talked about those things in traditional medicine. Interesting. So when I started learning about all these other possibilities of what could be causing people's illnesses, it was just amazing to me, and I just got into it deeper and deeper from that.
Okay, you know, for people just tuning in, we're talking about ozone therapy, but this is not what, you know, what you do primarily. I mean, I mean, you have a practice in Santa Monica. You deal with women's health, men's health, nutrition, exercise, nutritional supplements, bioidentical hormones. But one of the therapies you offer is ozone.
Well, if you want to paraphrase a lot of what I do, what I try to do with my patients is I try to treat them without the use of pharmaceuticals.
Okay, ozone. What else are you using it for?
A lot of
goes
fatigue,
right. Okay,
chronic fatigue.
Chronic fatigue.
People with all sorts of inflammatory conditions. I've been giving it to people with lupus and people with scleroderma and people with crippling arthritis. It helps.
What are the results, though?
It's a chronic treatment, but people definitely feel better and they get better slowly. It depends on how advanced their illness is when I first see them. If I see them and they have an advanced disease, it's very difficult.
Autoimmune or arthritis, things like this, right?
Right.
What's your take on what's the mechanism? How is shooting ozone?
Well, it's a multidisciplinary approach because you have to try to uncover the cause of the illness. And that's what functional medicine is. It's really getting to the root cause of the illness and trying to correct it from that root cause. It's not just treating the symptoms, which is really what traditional medicine does. So the ozone therapy fits that model because one of the big things it does is it boosts the immune system and it helps make your immune system more robust so you can fight things off yourself without having to take medication.
Could anybody, an expert, sit here and say that is dangerous, putting ozone in your blood?
I'm sure experts would say that.
What is their biggest criticism?
But the literature, there are hundreds and hundreds of thousands of cases of ozone therapy if you look at the world's literature, and there has never been an adverse event from ozone other than a doctor error, like doing something wrong with the IV or something like that. But the ozone gas itself has never harmed anybody.
So look for a doctor that has a setup for ozone therapy. And is it expensive?
The treatments range from about $200 to $250 a piece, so it can add up.
And how soon?
Insurance companies won't acknowledge it.
What's the best result you've ever had, where the patient just loves this?
I would say this young man with the unknown virus.
Have you ever done it yourself?
I've had ozone treatments.
Okay.
I'll give you another example. My son is a college basketball player, and he had a severe viral illness. He had a big basketball game he had to play, and he had high fevers, 103, 104 fevers, and I didn't want him to play. I said, you got to stay home. He says, I have to play this game. So he came to the office, and I gave him 50,000 milligrams of vitamin C, and I gave him an ozone treatment, and he went out and scored 35 points.
Okay, so you're a firm believer. Okay, and where can they go to learn more about this ozone treatment, by the way? Where do they go? Is there a website to learn more about ozone?
They could look it up on a website. It's called hyperbaric ozone therapy. It's an intravenous treatment. It's not the hyperbaric chambers that a lot of people will think of when they think of hyperbaric. The reason it's called hyperbaric is because the ozone gas is pumped into this bottle with the blood under pressure. And then the pressure forces the ozone into the blood. The blood actually normally comes out dark red or almost purple. And when you put ozone in it, it turns bright red like oxygen. And you give back that highly loaded, oxygenated blood. And people usually feel better almost immediately. I have one guy who comes to see me. He's a bodybuilder. And he comes in, he gets a double ozone treatment. He gets 2 bottles of oxygenated blood. And then he goes straight to the gym. And he says he lifts 30 pounds more weight in general when he ozonates before he goes to the gym.
Interesting, interesting. Well, look, always a pleasure to have you on the show. We're out of time.
Great.
And we'll have to have you back. So,
Great.
Dr. Liebowitz, thank you for coming on the show.
Thank you, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.